Okay, so think about this. You're looking at healthcare options, maybe somewhere else in the world, maybe even just a different city. How do you actually know if that hospital, operates with the same kind of commitment to safety and quality that you might expect closer to home?
Yeah, that's a huge question. And it brings up this whole issue of how healthcare organizations, which can be so different depending on where you are, how they show they're meeting these really essential standards on an international level.
Exactly. Which is, well, what we're digging into today.
Right, we're doing a deep dive into Joint Commission International Accreditation. You'll often hear it called JCI.
JCI.
And
Yeah.
it's way more than just a piece of paper hanging on a wall. It's seen globally as a benchmark for healthcare quality and, maybe most importantly, patient safety.
Right. So it's not just some local award. It signals that they're following international principles. And today we're really going to try and unpack what JCI accreditation involves and, why it matters so much for hospitals and clinics around the globe.
Yeah, and to get a good picture, we've looked at info straight from Joint Commission International itself. We've also drawn on insights from the QI Playbook podcast
Okay.
and looked at perspectives from India's National Accreditation Board for Hospitals and Healthcare Providers. That's NABH, plus groups like Supreme Medic, which is a consultancy, and ISQA, the International Society for Quality in Healthcare.
So different angles on this.
Exactly. Gives us a pretty rounded view of accreditation.
So our aim here is really to give you a clear handle on this whole international healthcare accreditation thing. By the end, you should get what it is, why it's a big deal, and kind of the key things organizations have to focus on to get and keep these standards.
Think of it as your shortcut to getting up to speed on a really critical part of global healthcare.
Okay, let's dive in then. What is JCI accreditation exactly?
Right. So JCI, it's like you said, it's the international branch of the Joint Commission, which most people might know from the U.S.
Yeah.
And JCI accreditation is basically this global stamp of excellence. It's for all sorts of healthcare places, hospitals, obviously, but also clinics, whole healthcare systems, labs, ambulatory care centers.
So pretty broad then.
Very broad. And getting accredited means they've met these really specific, pretty demanding standards, all focused on patient safety, the quality of care they provide, and showing they're always working to get better.
So it's proof, actual proof they meet tough criteria. What sort of things did these standards cover? Sounds like a lot.
Oh, it's incredibly comprehensive. The standards really touch on almost every part of how a healthcare organization works.
Like
Direct patient care, how they handle medication safely, infection control measures, hospital management, leadership, even patient rights. It's meant to be a really holistic look.
And that global recognition part seems really central, doesn't it? It's not just known in one region.
Absolutely. That's key. That worldwide recognition makes JCI a real symbol of trust. If you're a patient, maybe traveling for medical care, seeing that JCI seal gives you a significant level of confidence.
Makes sense.
And another really big piece is this idea of continuous improvement. It's not like you get accredited and you're done. The expectation is that these organizations are constantly looking at what they do and finding ways to refine it.
Which makes sense. I mean, healthcare changes so fast. The standards have to evolve too. I also saw something about enterprise accreditation. What's that about?
Ah, yes. That's geared towards bigger healthcare systems, ones that run multiple hospitals or clinics.
Right.
Enterprise accreditation lets them show that commitment to high standards, safety, quality across their whole network, not just facility by facility. It ensures consistency, so patients get that same standard of care whichever hospital in the group they go to.
Got it. Okay, so JCI accreditation is clearly important, but let's dig a bit more into why it's so critical. We've mentioned the global recognition. What else makes it so vital for a hospital to go for this?
Well, beyond just the reputation, there's a huge focus on improving patient safety. That's probably paramount. JCI standards actually mandate that organizations put systems and processes in place specifically to cut down the risk of errors and, bad outcomes. Things like medication mistakes, hospital-acquired infections. It's all about making the environment safer for patients.
Like that example from HCG you mentioned earlier.
Exactly. Dr. Gupta talked about how implementing a specific JCI-recommended hand hygiene protocol led to a noticeable drop in post-op infections. That means better outcomes, shorter stays, real impact.
Absolutely crucial. And I guess that ties directly into the next point. Enhanced quality of care. How does accreditation actually lead to better care?
It pushes organizations to use practices that are backed by solid evidence, stuff that research shows actually works, evidence-based practice.
Okay.
And it keeps that focus sharp on continuous improvement. It forces them to measure how they're doing, spot areas where quality might be slipping, and then actually do something about it to improve care delivery.
So it's proactive, driven by data, not just waiting for problems.
Exactly. And think about hospitals and, say, developing healthcare systems. JCI gives them a really valuable framework to align with global best practices. It helps them kind of level up their standards.
That's a really good point, helping bridge those gaps. What about the nuts and bolts, the day-to-day running of the hospital? Does JCI actually help with that?
It really can. Because the standards cover so much quality management, using resources well, going through the accreditation process often makes organizations more efficient.
Interesting.
Focusing on patient-centered care and streamlining how things are done can cut waste and just make the whole operation run smoother.
So better for patients and potentially better for the hospital's bottom line too, and I assume happier patients.
That's definitely the aim. When a hospital consistently meets these standards, they're usually better at meeting patient needs and expectations. That leads to better experiences, better outcomes, and, higher satisfaction.
Okay, so we've got the what and the why. Let's get into the how. What are some of the specific areas these JCI standards actually look at? What does it look like when they're assessing an organization?
Right, there are several really key areas. Number one, no surprise, is patient safety and quality of care.
The core stuff.
Absolutely. This means having solid systems to reduce errors, boost safety, and keep improving quality. Think about managing medications, right patient, right drug, right dose, right time.
Critical.
Or effective infection control programs to stop those infections spreading in the hospital. They also look hard at how outcomes are tracked and analyzed.
Makes total sense. What else is high on the list?
Patient rights and education. That's another big one. JCI really stresses treating patients with respect, making sure they're informed, involved in decisions about their own care.
So they're active participants.
Exactly. And that they understand their rights and also their responsibilities as patients.
So it's not just the medical side, it's the whole experience.
Precisely. Then, infection prevention and control, which we touched on. This means having really thorough programs, from hand hygiene basics to sterilizing equipment properly, and having clear plans if there's an outbreak.
Essential. What about the people running the place?
Leadership and governance, definitely. JCI checks for a clear structure, who's responsible for what, and policies that promote accountability and transparency. You need good leadership for this to work.
Makes sense. You need that top-down commitment and the staff doing the caring.
Yep. Human resources and staff competency. Are the staff qualified? Do they get ongoing training? They look at hiring practices, training, how performance is evaluated.
Can't have quality care without quality people. What about patient records? That must be huge.
Medical record keeping is vital. Records need to be accurate, easy for the right people to access for care continuity, but also kept confidential to protect privacy. Super important for safe, seamless care.
Absolutely. Both for treatment and privacy. And the building itself, the environment.
Facility management and safety is another area. Is the physical place safe? For patients, for staff? Do they have fire drills, emergency plans? Are they ready for disasters?
Wow, okay, so it really covers everything from the bedside to the boiler room, almost. And you mentioned continuous improvement being woven through all this. How's that specifically checked?
Continuous quality improvement, or CQI, it's kind of baked into everything. JCI expects organizations to constantly evaluate performance, collect data systematically on processes, on outcomes, and then use that data to make changes, to improve. It's this ongoing cycle.
Assess, act, reassess.
That's it.
It sounds incredibly thorough, almost overwhelming. Now, it's one thing to read the standards, but what's it like to actually go through it? I know the QI Playbook podcast talked about this.
Yeah, they spoke with Dr. Ramesh Gupta, the CEO of Healthcare Global HCG, a big hospital group that got JCI accredited. His perspective, having lived through it, is really insightful.
What did he say? What was it like getting accredited?
He really emphasized just how comprehensive and, frankly, demanding it is. It forced them to look at absolutely every single part of their hospital operations.
Everything.
Everything. From when a patient walks in the door to when they leave, making sure all those processes met the JCI quality and safety benchmarks. He mentioned lots of assessments, internal audits, loads of staff training.
Sounds like a massive undertaking, a huge investment of time and effort.
Definitely. But he said the biggest impact was on their overall patient safety culture. JCI's intense focus on reducing errors and improving outcomes really pushed them to strengthen their protocols, infection control, medication safety, how they monitor patients.
So it drove real change.
Absolutely. And they became much more data-driven, constantly looking at their performance numbers and tweaking things based on what the data showed.
So more than just getting the certificate, it genuinely improved how they worked. What advice did he have for others thinking about JCI?
His main points were, really understand the standards beforehand, invest in preparing your teams properly, and crucially, get full buy-in from leadership right from the start. It has to be driven from the top.
Makes sense.
And like we've been saying, remember that it's not a one-off project. It's about committing to continuous improvement, always.
That's really valuable, hearing it from someone who's been in the trenches. Now, JCI is obviously a huge player internationally, but are there other key groups involved in setting healthcare quality standards?
Oh yeah, it's a whole landscape out there. For example, in India, you've got the National Accreditation Board for Hospitals and Healthcare Providers, NABH.
NABH.
That's a really good example of a national accreditation body. It shows that many countries have their own quality standards and programs, often tailored to their specific situation.
So JCI has that global status, but there are national players too. What about groups that support quality improvement more broadly, internationally?
That's where an organization like ISQA comes in, the International Society for Quality in Healthcare.
Nice.
Yeah. Their focus is more on promoting quality improvement across healthcare systems worldwide. They don't accredit hospitals like JCI does, but they champion best practices, and importantly, they actually evaluate the accreditation bodies themselves.
Ah, so they accredit the accreditors, in a way.
Kinda, yeah. It helps ensure rigor and credibility across different programs. And then you also have consultancies like Supermedic we mentioned that help hospitals navigate these accreditation processes, whether it's NABH or others. So there's a whole ecosystem around quality standards.
Okay, so multiple layers, all pushing for better, safer healthcare. Let's just quickly revisit the benefits of JCI specifically. We've hit on a few, but could you maybe summarize the main advantages for a hospital?
Sure. I'd say first, it clearly enhances patient care quality, focusing on safety, outcomes, patient satisfaction. Second, that big one, global recognition. It signals quality internationally, which is great for attracting patients, partners.
Builds trust.
Exactly. Third, operationally, it drives improvements in efficiency. Fourth, it helps with compliance and managing risks. And finally, it really boosts employee engagement. Staff tend to feel pride working in an organization committed to such high standards.
Those are pretty compelling reasons. And I remember reading that data collection is a huge part of the JCI approach, right?
Absolutely fundamental. JCI standards require organizations to collect and analyze data for quality improvement. They need to pick solid, evidence-based measures relevant to their patients and services.
So you have to measure to improve.
Precisely. And it's worth noting, JCI's own specific library of measures was retired. They now suggest hospitals can look at the Joint Commission's performance measures for guidance on what data to track and how to use it effectively for improvement.
Got it. So it always comes back to measuring, analyzing, and using that information to make positive changes.
That's the core loop, yes.
This has been really enlightening, a great deep dive into JCI. To wrap things up, what would you say are the 3 biggest takeaways for someone listening to this?
Okay, 3 key things. First, the global recognition of JCI. It's a respected international NARC-signifying commitment to high-quality, safe care.
Okay, global standard.
Second, understand that getting and keeping accreditation is a rigorous process that really drives a culture of continuous improvement inside the organization. It's not static.
Drives ongoing improvement. Got it.
And third, ultimately, JCI accreditation is a powerful signal of an organization's deep commitment to care that's not just high quality and safe, but also truly patient-centered, focused on the patient's needs and rights.
Excellent summary. Global standard drives improvement, shows patient-centered commitment, and that really leaves us with a big thought, doesn't it?
Yeah.
Well, in a world with such diverse healthcare systems, how can we as patients, figure out the quality and safety of care we might get? What role do things like JCI actually play in giving us that confidence, that assurance?
That's a crucial question for everyone to think about, especially as healthcare becomes more global.
Definitely something to ponder. How do we navigate this complex landscape as informed individuals?
Absolutely. And if you are interested in digging deeper, I'd definitely suggest checking out the Joint Commission International website, or maybe the NABH site for a national perspective, or ISQA for that broader global quality view.
Good resources to explore.
Yeah, it's worth thinking about what these standards really mean for your own understanding of healthcare quality, wherever you might encounter the system.